So, good afternoon, everyone. These are the mode of transmission and the diseases that we can get in the digestive system. First on the list is the gastroesophageal reflux disease, or also known as GERD. The mode transmission of this disease is Helicobacter pylori, or H. pylori is a type of bacteria. These germs can enter to your body and live in your digestive tract pylori. A bacteria that can cause GERD and gastrointestinal inflammation is contagious person to person through either fecal or oral exposure. Mo na nito magkaunta og food that is contaminated, or drink water na contaminated, or we go to a pool or swimming or like sa ocean na contaminated ang water, like dirty. So we should be careful sa eating or drinking and also swimming. Di ta magbiga-biga lang dito sa swimming pool, or oral to oral exposure. We should be careful also na GERD also can transmitted through kissing or sharing toothbrushes. So the second one is the peptic ulcer disease, or PUD, and gastritis. An ulcer in the stomach is called a gastric ulcer, and an ulcer in duodenum is called duodenal ulcer. Most ulcers are caused by bacteria called Helicobacter pylori or H. pylori. So ang GERD ug ang peptic ulcer and gastritis kay na ay similarities. Same lang sila og bacteria na naga-cause sa sakit, which are believed transmitted from person to person through close contact and exposure to fecal matter or vomit. So nalang po sila similarities, or similar na gyapon sila sa mode of transmission, which is the person can cause to person contact. So the next one is, or the third one is the stomach flu. The most common ways to catch the stomach flu are by touching contaminated surfaces, or objects, and having skin-to-skin or hand-to-hand contact with an infected person. Although ang stomach flu kay also ang contaminated food and water may also cause. Pero ang mode of transmission gyapon niya is skin-to-skin or hand-to-hand contact with an infected person. So the next one is the gluten and sensitivity and celiac disease. It is an autoimmune condition and it is not infectious. It can't spread from person to person. So ang celiac disease kay di siya ma-spread from person to person. And then the next one is the inflammatory bowel disease, or also known as IBD. Ang IBD can spread quickly in secretion from a sick animal, either by direct contact with an infected animal, by particles enriching healthy snakes kept in close proximity to stick one, or by poor sanitation practices leading to spread by the snake keepers. And then the next one is the irritable bowel syndrome, or IBS. It is not contagious, inherited, or cancerous. Di siya inherited, di ko siya cancerous. It occurs more often in women than in men. So ang IBS, mas more makita mo siya, or sa women siya nag-exist than sa men. And then onset occurs before at the age of 35 in about half of the cases. So girls, be careful, baka maka-experience of irritable bowel syndrome, but don't worry, kay di siya contagious or cancerous. The next one is the constipation. Ang constipation kay cause lang of lack of fiber in diet. Most cases of constipation aren't caused by a specific condition. It may be difficult to identify the exact cause. Mauna ang constipation. The next one is the hemorrhoids. Ang hemorrhoids kay di po siya contagious. Hemorrhoids are not contagious. They can't be transmitted to other people through any sort of contact, including sexual intercourse. Ang hemorrhoids, so it means dili siya ma-transmit from person to person. Masking mag-unsa pa mo dira, masking mag-sex pa daw, di siya mag-transmit. The next one is the diverticular disease, or diverticulitis. Is not contagious also. It is not transmitted from person to person. Last one is the gallstones. Usually it occurs when you sa family ninyo or one of your family member has a gallstone history. Gallstone seems to run in some families, or it is inherited. There there may be a genetic link. That's all. Here we are now for the treatment and the diseases that we can get in digestive system. The first one is the GERD. Proton pump inhibitors, PPIs, and histamine H2 receptor antagonists, H2RA antacids. Antacids or prescription strength acid blockers can also have. So, ang H2 receptor ginamin is ranitidine. And for the PUD pod, prescription and over-the-counter medication is omeprazole, lansoprazole, rebeprazole, esomeprazole, and pantoprazole. Antacid and proton pumps inhibitors. Same lang sila sa GERD, mga PPIs. And for the stomach flu pod, prescribe an antiemetic such as promethazine, prochlorperazine, metoclopramide, or ondansetron to stop the nausea and the vomiting. And also, we can recommend to those people who have stomach flu mag-inom a lot of water and drink electrolyte drinks to prevent dehydration. And for the celiac disease, drugs such as azathioprine or azathioprine or budesonide, Entocort EC or Euceris. Eliminating gluten, uprooting in wheat, rye, barley, and oats from your diet is the main treatment for both conditions. So you can eat protein in wheat, rye, barley, and oats para ma-treat ang celiac disease. And for the IBD, metronidazole, flagyl, and ciprofloxacin or Cipro are the most commonly used antibiotics in persons with inflammatory bowel disease. Drugs that block your immune response can treat IBD. Sometimes, pag worse na kaayo, surgery is necessary. And for IBS, alosetron, Latronex, treatment may include eating smaller meals and avoiding foods that cause symptoms. Some people take laxatives, fiber supplements, or probiotics to treat IBS. For the constipation, lactulose, Cefolac, Consulose, Dufolac, Enolose, Crystalos. Mo nang inumon if you're having constipation. Bulk-forming laxatives are the first line treatment for most patients with constipation. Bulk-forming laxatives are gentle, safe, and effective. Pwede po tayo mag-inom og Bisocodil Dulcolax. And for those people who are experiencing hemorrhoids, an antibiotics such as doxycycline or doxyteric is used to treat an infected hemorrhoid or infected tissue caused by a procedure to remove a hemorrhoid. For the over-the-counter naman, hemorrhoid cream or suppository containing hydrocortisone. It should have a hydrocortisone. Also, we can have a warm bath to relieve the pain and itchiness. Some people may be embarrassed to share na nasa sila hemorrhoids, but we should prevent this before to get worse. Ang diverticulitis naman, a typical oral antibiotic regimen is a combination of ciprofloxacin or trimethoprim, sulfamethoxazole, and metronidazole. Monotherapy with moxifloxacin or amoxicillin or clavulanic acid are appropriate for outpatient treatment of uncomplicated diverticulitis. Daghan jud siya, you may need antibiotics, a liquid, or even a surgery to treat diverticulitis. And for the last one is the gallstone. Ursodiol is used to dissolve gallstone in people who do not want surgery and cannot have surgery to remove gallstone. Kaya sometimes there are some or a lot of patients na mahadlok og surgery. So the doctors recommended ursodiol to remove gallstones, but better to have surgery to treat gallstones. That's all, and thank you. I hope na ay lessons na na-learn for this report. Thank you so much.